Hey all, my name is Chung Brewer. I am a speech-language pathologist and author of the Adult Speech Therapy Workbook. Today I wanted to do a deep dive in the Adult Speech Therapy Starter Pack, 2nd edition. It's an 1,000-page long honker. I don't recommend you print it out. I printed it out for my own references as the author to remember all the things that we put into it. But I did want to illustrate to you today the scope, the breadth, the depth of the starter pack, and also how I use it as a home health therapist. I also have experience in telehealth, acute care, inpatient rehab, SNFs, outpatient, and I know that the resources that you find in here and the materials in here can also be used in those settings. So let's get started. The starter pack comes with the workbook, 2nd edition, updated version of the goal bank, which is very popular, the medical SLP reference chart, updated again. There's a whole new thing called the protocol packs, which I'll talk about in a second here. We also have all new assessment packs. They're reformatted and restructured. And we also have an updated version of the documentation guide. So about half of what you get in the Starter Pack 2nd edition is the 2nd edition of the Adult Speech Therapy Workbook. This is meant to be your go-to workbook that you use with most of your patients, if not all of your patients. It goes from every major thing that we diagnose and treat, from dysphagia, aphasia, AAC, fluency, visual neglect, executive functioning, all of the above. There's a chapter on it. There's informational handouts for the patients and the care partners, and also functional worksheets that go from very simple to more complex and more functional everyday things for your patients. I'll show you really quickly the worksheets and handouts that I use the most in the field. I tend to use a lot of the informational handouts. So if somebody's has a swallowing impairment, but they never heard of the word dysphagia, then I'll give them the rundown. It says dysphagia, oral dysphagia, pharyngeal dysphagia, and so on. Another one I use a lot is oral hygiene. Most of our patients, if not all of our patients, are going to benefit from just a quick review on oral hygiene, but especially with those patients who are NPO or at a risk for aspiration, I go through this a lot with them and or their care partners. In terms of cognition, the one I use a lot with my mild to moderate patients who have memory disorders is ways to improve memory. It includes things like the memory strategies and also lifestyle changes that can help with their overall brain health and not just memory. And finally, I use these executive functioning handouts a lot, mostly with the patients themselves. Usually it's a mild to moderate issue that they're dealing with. I use this one specifically for care partners, especially if the person has a more moderate to severe executive functioning problem, so that they know, no, there's not an intelligence problem going on. No, there's not some like deeper, bigger thing going on. What's happening is that this person is experiencing an executive functioning impairment, and it could be all these things from lack of inhibition to lack of motivation and so on. And there's also executive functioning strategies over here. A resource I would love to point out in the starter pack is the goal bank. And I made this specifically because I could remember clearly being a graduate clinician and just having complete brain farts and not being able to come up with the words or the sentence structure or just basic verbiage on how to write these goals. So we wrote down goals for you. We give you the language, we give you the verbiage, we give you the words to use to help build your own goals. We break it down by disorder type again: aphasia, dysphagia, AAC, fluency, visual neglect, executive functioning. We put 12 different sections in here by a mild, moderate to severe issue. And this is all new, updated, all new goals that me and my colleague Alicia, we wrote. We have over 20 years of direct clinical experience, so we thought about what are the most useful goals that we can write, what are the most common goals that we write a lot too, and what are the more tricky ones that we do tend to use a lot, but we want to be able to give you some prompts, some words to use so that you could write your own to make it appropriate as much as possible for your patient. Brand new to the starter pack and to the world is something we call the protocols pack. It's an instruction manual for how to do the job. So essentially what we did is, me and my colleagues at Adult Speech Therapy, we essentially read all the textbooks on all the things related to speech therapy, and we distilled it into easy to digest language. The protocol packs give you treatment options. So let's say you know your patient has dysarthria. You know generally how to go about treating dysarthria, or maybe you don't. Maybe this is the first time you treated dysarthria. We give you options on how to treat dysarthria, evidence-based options that work, that are efficient, and that we have used ourselves in most of the cases, and that we found are useful and our patients enjoy. So for example, your patient has dysphagia. We know generally that there's things we could change textures, we can give strategies, there's exercises. We break down exercises step by step. In this case, respiratory strength training. We talk about expiratory and inspiratory muscles, and we talk about populations that could benefit from EMST, expiratory muscle strength training. For aphasia, we looked at so many research articles about response elaboration training and how to actually do it. And we break it down into words that are easily digestible. We recognize that if you're anything like us, you're busy, you're tired, you want to just be able to read the thing and understand it, so we try to break it down for you. Easy to understand language, actionable, step-by-step protocol on how to do the therapy. We redid all of our informal assessments, once again based on the latest evidence. We looked at what are the things that we should be assessing for each major thing that we do assess. For example, swallowing assessment, there's a questionnaire to ask, there's an oral Meccan examination, step-by-step guide, there's information on how to do the PO trials and some ways to write it out. For some people, having this printed out version is awesome, but these are also available as fillable PDFs when you buy it online. We have a straight up cognition assessment. This one I like to print out, and I like to print out one-sided because sometimes you'll be reading a piece of paper and then you'll be handing out another sheet of paper for your patient to fill out. We have a language assessment for receptive and expressive. Once again, some reading material for them. We also have some photo cards because those are typically handy with multiple assessments that we give. We also updated our documentation guide. We listened to all the very detailed, specific information about guidelines about the major payers in US, so like Medicare. What does Medicare want to see in your documentation? Once again, we wrote it out in plain language for you, step by step. When you first get an evaluation, progress report, treatment report, discharge report, what do you want to see? What do you want to have on there? We give specific examples of each of those things. And what I really enjoy about this one too is that we have updated checklists. Once again, as a PDF, it's a fillable form that you could check off. Pretty much that documentation guide, we put it in a checklist format. These are all the things that Medicare wants. So instead of having a really long guide about it, here's a checklist that you could refer to for evaluation, progress reports, treatment notes, and discharge notes. And we also have templates for the checklist, but it's in a little bit expanded form to give you more information about why are you even asking about these things? How should you look at these things when you're writing down that information? So it seems less abstract of why you're being asked to write this information, and it gives you more perspective, and documentation will start to make a little bit more sense. Some things are still gonna feel abstract, but if you follow these checklists, and those major payers are going to be happy with your documentation. You'll have defensible documentation. That's the goal of the documentation guide. Last but not least, I love color. I made these more colorful this time. This is the Med-SLP reference charts. I use this one especially a lot with my patients who have dysphagia or suspect they have dysphagia. A lot of times maybe you'll see a patient who had some sort of instrumental evaluation before and they said, yeah, there's a flippy thing in my throat that's not working right. So you could give them some more information about what that is, the epiglottis, what it does, talk about the different tubes that go down in their bodies. One goes to the lungs, one goes through the stomach. So I use this a lot for patient education, even though there's also information for us medical SLPs to use. A lot of good information here. Neuroanatomy, cranial nerves, differential diagnosis, rating SMART goals, severity ratings. And we also updated this form for exercises. I like these color ones. They're very engaging to our patients. What I would do is get like a blank piece of paper and then show the patient so they're focusing on the one thing. And on the back side, there's instructions for how to do the exercise, what you would say to your patient. I put these in these like self-laminated pockets that you can buy. You don't need a lamination machine, especially with this patient education. I'm handing it to the patient a lot so then I could clean it off afterwards. Thank you all for joining me. The starter pack is honestly a resource that I use on the job. I also use adultspeechtherapy.co. We have a really powerful search engine up there. So when I'm in front of a patient and I can't quite remember what that last point I wanted to make about a swallowing exercise is, I have my handy phone out, I look it up, and I go from there.